Hello friends, today we'll check out the COVID-19 ICD-10 coding guidelines for 2021. Since we have entered into 2021, there has been a lot of updates for coding the COVID-19 related diagnosis. So let us check how and how we can code the COVID-19 diagnosis codes in 2021 following the ICD-10 coding guidelines. So first is COVID-19 infection due to SARS-CoV-2. So here we have to code only the confirmed cases, code only the confirmed diagnosis of the 2019 novel coronavirus disease as documented by the provider or documentation of the positive COVID-19 test result. So here if the documentation is clearly mentioning and confirming the diagnosis of 2019 novel coronavirus disease, you have to assign code U07.1 as principal diagnosis. There is an exception for hospital inpatient coding guidelines. In this context, confirmation does not require documentation of a positive test result for COVID-19. The provider documentation that the individual has COVID-19 is sufficient. This is only for inpatient coding guidelines. And if the provider documents suspected, possible, probable or inconclusive code, do not assign code U07.1 because it does not confirm the presence of COVID-19 disease. Instead, only code the signs and symptoms. Sequencing. So sequencing will be when the COVID-19 meets the definition of principal diagnosis, simply code U07.1 as the principal diagnosis and followed by the appropriate codes for associate manifestation, except when another guidelines require the certain codes to be sequenced first, such as in obstetrics, sepsis or transplant complication. Acute respiratory manifestation of COVID-19. So when the reason for the encounter or admission is the respiratory manifestation of COVID-19, you have to assign code U07.1 as the principal or first listed diagnosis, and then you have to assign the code from the respiratory manifestation as additional diagnosis. Though there are following conditions and some examples for common respiratory manifestation of COVID-19. So let us check them. First is pneumonia. For the patient with pneumonia confirmed due to COVID-19, you have to assign code U07.1 as principal diagnosis for COVID-19 and J12.89 as other viral pneumonia. For acute bronchitis, the patient with acute bronchitis confirmed due to COVID-19, assign code U07.1 as principal diagnosis and J20.8 as additional diagnosis. Bronchitis not otherwise specified due to COVID-19 should be coded using code U07.1 and J40. Lower respiratory infection. If the COVID-19 is documented as being associated with a lower respiratory infection not otherwise specified, or an acute respiratory infection, code should be U07.1 and J22. Unspecified acute lower respiratory infection should be assigned. If the COVID-19 is documented as being associated with respiratory infection not otherwise specified, code should be U07.1 and J98.8. Acute respiratory distress syndrome. For acute respiratory distress syndrome due to COVID-19, you should code U07.1 and J80 for acute respiratory distress syndrome. For acute respiratory failure due to COVID-19, assign code U07.1 as principal diagnosis and code additional code from J96.0 series for acute respiratory failure. Non-respiratory manifestation of COVID-19. When the reason for encounter admission is non-respiratory manifestation of COVID-19, assign code U07.1 as principal diagnosis and assign code for the manifestation as additional diagnosis. Now for asymptomatic with actual and suspected exposure to COVID-19, you have to code Z20.822 contact with and suspected exposure to COVID-19. For symptomatic individual and actual or suspected exposure to COVID-19 and the infection has been ruled out or test results are inconclusive or unknown, you have to assign code Z20.822. For screening for COVID-19, during the COVID-19 pandemic, a screening code is generally not appropriate, so do not assign code Z11.52 and encounter for screening for COVID-19. For encounters for COVID-19 testing, including preoperative testing, code as exposure to COVID-19. Signs and symptoms without definitive diagnosis of COVID-19. For patient presenting with any signs and symptoms associated with COVID-19, but a definitive diagnosis has been not been established, assign the appropriate code for each of the presenting signs and symptoms such as cough, shortness of breath and fever. If the patient with signs and symptoms associated with COVID-19 also has an actual or suspected contact with exposure to COVID-19, you have to give assigning code Z20.82 for contact with and suspected exposure to COVID-19 as the additional code. Asymptomatic individual who tests positive for COVID-19. Although the individual is asymptomatic, the individual has tested positive and considered to have a COVID-19 infection. So personal history code for COVID-19, we have a separate code Z86.19. Follow-up visit after COVID-19 infection has resolved. So for individual with previously COVID-19 and being seen for follow-up evaluation, you have to assign code Z09 as primary code. For encounter of follow-up examination after completed treatment for condition other than malignant neoplasm, and you have to give the history code Z86.19. Encounter for antibiotic testing. For encounter for antibiotic testing, we have a separate code Z0184 followed by the as per the ICD-10 coding guideline. For antibiotic testing, we have to give Z01.84. Follow the applicable guidelines above if the individual is tested to confirm a current COVID-19 infection. Multi-system inflammatory syndrome. For individual with multi-system inflammatory syndrome and COVID-19, assign code U07.1 as the principal and diagnosis, and assign code M35.81 as additional diagnosis for multiple inflammatory syndrome. If the MIS develops as a result of a previous COVID-19 infection, you have to give code M35.81 and B94.8 for sequel of other specified infectious and parasitic disease. If the individual with a history of COVID-19 develops MIS and the provider does not indicate that the MIS is due to previous COVID-19 infection, assign code M35.81 followed by Z86.1 for personal history of COVID-19. If the individual with known or suspected exposure to COVID-19 and no current COVID-19 infection or history of COVID-19 develops MIS, then you have to assign M35.81 for MIS followed by Z20.82 for exposure code. Additional code should be assigned for any associated complication of MIS inflammatory syndrome as an additional diagnosis. Hope you have gained knowledge through this video. If you like the video, do share it and do subscribe to my channel for further updates related to medical coding. Thank you.